Thank you for joining us for tonight's webinar, Back to Business, Winter Livestock Health. My name is Tasha McGregor and I am with the Department of Primary Industries and Regions SA, and I'll be your host for this evening's webinar. Tonight's webinar is brought to you by Meat and Livestock Australia, Australian Wool Innovation in partnership with Livestock SA and Primary Industries and Regions SA, with support from Adelaide Hills Council. Our presenter for tonight's webinar is Dr. Jeremy Rogers, who is a Senior Veterinarian with the Department of Primary Industries and Regions SA. Jeremy has been a veterinarian since 1981 and has been practicing in Queensland, South Australia, Tasmania and Papua New Guinea before joining PIRSA in 2001. His role in PIRSA has included management of the South Australian Bovine Johne's Disease Program and the Emergency Response and Disease Surveillance Program. These roles mean responding to emergencies across Australia and investigating of unusual diseases or situations for producers when they arise. He's also, since 2012, has been the PIRSA District Vet for the Adelaide Hills, Murray Mallee and Kangaroo Island. So as you can see, we've got quite an experienced speaker here for you this evening, and now I'll hand it over to you, Jeremy.
Thanks, Tasha. This afternoon, we're talking about a range of topics, and I'm aware that I'm talking to some very experienced producers and perhaps some that are starting out on that trip. And perhaps if you're in the Adelaide Hills, particularly if you're in a fire-affected area around from the Cuddly Creek fire especially, you might be at a different level to some of the others. So it's quite a widespread audience tonight. Or today, and particularly I'll have in mind that I'll be speaking perhaps to Kangaroo Island people as well. So some of the topics I'd like to talk about is a couple of weeds that you'll see pretty commonly and issues this time of year, and that's capeweed and soursop. What vaccinations might be due and how to vaccinate properly in sheep, more so sheep than cattle. Worm management, and I'll spend a little bit of time talking about worms with cattle, but mainly about sheep. General nutrition comments, and some commentary on trace elements and other minerals, pregnancy issues and lamb survival, and then recovery from fire damage and introduced sheep, cattle and hay. So most of you will have seen this weed around your roadsides, in your backyard, in your paddocks. It's very common. It's not a disaster to have it. In fact, it's so widespread. It's difficult to get rid of sometimes. And for a certain amount of time, for a couple, 2 or 3 weeks, it's a reasonable sort of feed for cattle and sheep. Most people notice that cattle and sheep get scours when they are eating this, and that's because of the very high nitrogen content of this plant. So it provides some sort of nutrition, and they'll do okay on it for a little while, but it tends to go off fairly quickly. Because it's very high nitrogen, it also tends to reduce the absorption in the rumen and the intestines of calcium and magnesium. So if you have lambing ewes or cows that are trying to lactate or are lactating, have calved, and there's a lot of this plant in your pasture, you might want to consider supplementing with calcium and magnesium to prevent grass tetany or pregnancy toxemia as well in some cases. You should always supplement, if there's a lot of capeweed in the diet, you should always supplement with some good hay. Most people find that tends to help them dry up a bit and not be so loose. But bear in mind that this plant only is reasonably good nutrition for only 2 or 3 weeks, and then it tends to go off. So that's capeweed. Occasionally we'll see some poisonings with capeweed, and that's a nitrite poisoning, but it's quite rare, and usually when there's nothing else to eat. Soursop. Most of you will be pretty familiar with this plant, and it tends to grow in degraded areas, often the first green thing that livestock will see. So most of you will have pastures now or some sort of plants growing after the rains that we've been very fortunate to have. This is a very common weed. It'll certainly kill livestock that eat it, if they eat enough of it. Cattle can obviously eat more of it than sheep will or can, and not seem to suffer too much damage, but only a couple of weeks ago, I saw some lovely sheep, pregnant ewes, heavily pregnant ewes, killed by soursop, and they were grazing a pasture that didn't have a predominance of this plant, but they seemed to have a taste for it, which happens with sheep sometimes. The symptoms of soursop poisoning can look very much like pregnancy toxemia, and I'd like to show you this movie clip now. Here we go. It's a bit of a grainy video, and that doesn't particularly matter, but I'd like you to have a look at it and see what you think. You'll see a ewe there. She's a stud ewe, down on her knees, looks a bit uncomfortable, and then she's got a wide base stance at the back, sits down, and then reluctant to move. Now that ewe was heavily pregnant and due to lamb in about a week, and most people would say that's pregnancy toxemia. In fact, it was sow sop poisoning, which really damages the kidney. So my point in showing that video was to demonstrate that many things can look the same. And one of my pet gripes is when people say, oh, that's pulpy kidney, or that's pregnancy toxemia, or whatever it is. And it's not that at all. And I often make mistakes too when I see things. So if you're seeing deaths in your ewes, or you're seeing abortions, I know there's some of that happening around on the island at the moment as well, then we certainly need to investigate it and get onto it. Don't just assume that it's something you've seen before and that's that. It may well be, but don't just assume. So vaccinations now. Vaccine depends on the species, so cattle or sheep or goats or alpacas or whatever you particularly have, their age and the risk and the kind of management. So they're all factors that you need to bear in mind. I think most of you will have a routine where you vaccinate, so for example, your ewes before they lamb, and then you vaccinate the lambs when they're weaned or when you're lamb marking, and so on. And that's just a routine that you do, and I understand that. But occasionally the risks will actually change. So whilst that may work for you most years, maybe all your life, there might be occasions when it's not enough. And certainly the next point, timing of vaccines. A lot of people give their lambs, as I said, a vaccine at lamb marking or tailing, but unfortunately they miss out on that second one, which is really quite important if the risk is high. How do you know if the risk is high or not? If they're more intensively managed, so going into feedlots, which many will be, being finished in a feedlot with grain and so on, then that's a higher risk environment. Or if it's an unusual year, a lot more rain, or a really lush green pasture and so on, you might be in danger of things like pulpy kidney as well. For the first time this year, I've seen a really unusual clostridial disease called blackleg in sheep in the Mallee, just turned up on a property, never seen it before. And so some of these diseases are around, they're really still quite rare, but in a good year, you tend to see more of these clostridial diseases than in pretty tough years. So just be aware of that and think about where your animal might end up in its life, in its immediate future, like a feedlot. Then you might use a different vaccine schedule or different vaccines for that purpose. A question that a lot of you will think of is, should the vaccine contain selenium and or vitamin B12? So selenium tends to be deficient in the black soils and heavier soils of the Adelaide Hills. So if you're living in those areas, it's generally selenium deficient and not copper deficient. Again, talk to your vet or local PIRSA people. They'll know if your area is selenium or copper deficient. If it is, then you should be supplementing. Selenium is one of the few micronutrients that's actually poisonous if you do too much, so be careful about that. But if they're deficient, then they'll need it. If the country is deficient, then they will need topping up. So a lot of our heavier, higher rainfall country is deficient in selenium. I mentioned copper, I think, in the sandy soils. Vitamin B12 is also deficient. That's to do with cobalt, and that's also deficient in the sandier and lighter country. So if you got the choice of buying a vaccine for sheep in particular that's got B12 in it, I'd always do that. It's cheap. It's very little different. I think it's about 10 cents difference in the dose, but they always seem to do better with an injection of vitamin B12 when you do that. So certainly cobalt and copper in the lighter country, and selenium in the heavier country. Well, with sheep, for example, I'm not promoting any particular brand or type of vaccine, but this is a common one that you'll find in Platinum Ag or Nutrien or Elders anywhere in their fridge, and they'll happily sell it to you. Many people say, should I use a 6-in-1 or a 3-in-1, or should it have, as I said, should it have selenium and B12 in it, and so on. In addition, do you need to use Erivac or Campivax, Gadare, ScabiGuard, and there are a couple of other vaccines as well, but that's pretty much the range for sheep that many people were thinking about. I don't have the time right now to go into each of those vaccines and the fors and against, but my suggestion to you would be ask somebody, not necessarily someone who's selling vaccine, but someone who can give you a good opinion, your veterinarian, PIRSA staff and so on, in many cases retailers as well, what you should be doing. Some of you probably should be using Campivax, some of you should be using ScabiGuard, for example, and many of you closer to the border of Victoria are already using Gadare, which is against Johne's disease, of course, and Erivac is commonly used by many people. Of course, you can use all of those vaccines if you wish, no harm done, but it gets a bit expensive and more labour as well. One really important thing that I continue to see is being done incorrectly is the right needle length. So try and use, especially with lambs, use a 1/4 inch needle and then put it in perpendicular to the skin, not at an angle. So I grew up using a 1/2 inch needle at an angle, and that's now known that's not the best technique. So use a shorter needle perpendicular to the skin and you won't get those carcass damages and pain. Again, behind the ear, in the neck is the best place, certainly not on the back or around the breech or around on the abdomen, anywhere like that. It's much better done behind the ear or on the neck, high on the neck, and there's some very good resources on vaccine manufacturers' websites to show you where you should be vaccinating properly. With cattle, there's a lot more vaccines available. Cattle live longer and they are longer in feedlots and so on, and these vaccines tend to be geared to more intensive production. So there's a whole lot more available. Again, get some good ideas, some good advice from your veterinarian or PIRSA staff about what vaccines you might be considering. Again, most of you will use a 3-in-1 or a 6-in-1 at calf marking time, and mostly that's good enough. In fact, I very seldom see cattle die from vaccine preventable illness, but I sometimes wonder how much some of them are being lost or suffering a bit of below par health because that could have been helped with a different sort of vaccine, for example, a respiratory virus vaccine. Again, there's so many vaccines that you can spend a lot of money and time and energy on them, and they're not necessarily going to be helpful, but get some good advice about what vaccines might help your business to do even better than you're doing now. Worm management. Again, many people have a routine here and that works fine. Again, just consider that this year may be different. Certainly will be different to the last few years when we're in drought. So bear in mind that if you've got more lush feed, more rain, you're going to have more parasite problems. So think about your vaccine, your worming program, and think about using worm egg counts. They're very simple to do. They're cheap and effective ways of monitoring whether you need to drench at all or whether you should be drenching more. In the Mallee, where I do a lot of my work and see a lot of sheep in the upper southeast, we don't see a lot of worm resistance at this stage, but certainly there is worm resistance to some of the common drenches in some of the other parts, probably in Kangaroo Island, I believe, and certainly in the lower southeast. There's plenty of worm resistance down there. So again, get some advice about what you should be using and how you should be measuring that, and worm egg counts. So there are some very good websites. Just Google worm egg counts. I'm sure you'll come up with techniques for collecting them. It's really easy, and I think more people should be doing it. Most retailers, Nutrient, Platinum Ag, Elders and so on, and your vets in rural areas will offer a worm egg count service for you. Costs usually about $20 or $25. So it's a handy tool to use, particularly in your lamb mobs. So here's a slide I'd like you to have a look at. This was taken only a few weeks ago, some sheep up in the mid-north area. And most people looking at those sheep, you'll notice that they're not particularly dirty around the backside, but they're looking pretty ordinary, those ones in the roast especially. And many people would be inclined to think, oh, well, perhaps they're wormy and we'd better give them another drench. But they're a bit puzzled because they're not scouring. In fact, that's Johne's disease that was diagnosed on this property. And that's really something to keep your eyes open for, because many people don't notice it until it's spread widely throughout their flock. Fortunately, this guy got onto it pretty early, but these are West Australian sheep. And it's certainly a risk when you're buying in sheep, and I'll talk a little bit more about that later. If you're buying in sheep from other areas or from interstate in particular, just be aware of some pitfalls and things that you might get for free and then didn't bargain on getting. Worm management in cattle, generally they're pretty resistant. Adult cattle are pretty resistant to worms, but many of you, particularly in the wetter areas, will be drenching your cattle as well in spring, and that's a good idea. Just bear in mind, worm egg counts with cattle are not as good as they are in sheep, so it can be a little bit more difficult to tell whether you need to worm or not. But many of you will be experienced and know and will have a pretty good idea of when your cattle need worming. But there are some other tests that can be used, blood tests that will tell whether your cattle are impacted by worms or not. So think about those. Bear in mind that stocking density, if you're increasing your stocking density for whatever reason, whether it's drought or after fire because you just haven't got the pastures available because your fencing's been burnt or something like that, that's in fact like an overstocking, and your parasite issues will build up. So if your stocking density is higher than you're normally used to, then be aware that you might have to factor that into your parasite management and get some advice on how you should measure that and what intervals you should drench at, what drench you should use, and so on. You might not have a problem, but beware, because you can, and all that will cost you money in the long run if you don't get it right. General nutrition and winter management. It's been pretty cold lately, as I'm sure we all know. And at that time of year, we need more energy, and so do animals, particularly lambs and calves, cows that are lactating. They're all going to need more energy and more protein. So you feeding twins, and same for cattle. You cattle feeding their calves are going to be needing 2 to 4 times more food than they do just to maintain themselves ordinarily. And you can add more to that if you get very cold, wet weather. So just factor that into your feeding of hay, as many of you will be using hay still before the pastures come away, particularly on KI and some of the colder areas. Just need to bear in mind, you've got to keep that feed up. And investment, that's that last line, the investment in improved nutrition will pay big dividends all around. So if you keep your sheep in good condition, then they'll get in lamb easier and quicker and more. They'll get more lambs next time around, and the lambs will be healthier as well. So nutrition is really the fundamental of a lot of the health issues that we see. Well, what about trace elements and calcium and magnesium, which are not trace elements? They are elements that they need in good supply. Just a note there that previously there wasn't an injectable copper compound that was registered for use in sheep. Some people were using the cattle one, but it causes problems. So there is one now for sheep. So if you're in a copper deficient area, which is most of the areas that have light sandy soils, are copper deficient, then that's available. You might consider using it. Again, get a little bit of advice whether you need to or not. Many times you won't need to, and there are other ways of supplementing copper that's actually a lot more efficient than injecting it, but it is available. If you're feeding a lot of grain in your diet, which many of you won't be probably at the moment, but especially if it's over 50% of your requirements, you must supplement calcium, because grain, all of the grains, barley and wheat, are deficient in calcium, high in phosphorus and deficient in calcium. Many people find the easiest way to do this, especially with sheep, and especially in feedlot or containment feeding conditions, is to mix a 50-50 mix of stock lime and stock salt in half chemical drums. So those 20-litre drench drums, put them in an old tyre, and a 50-50 mix of stock lime and stock salt. Some people suggest also a 1/3 lime, 1/3 stock salt, and 1/3 magnesium oxide as well, particularly if you're in a highly productive area and you've got a lot of twins and triplets, because those ewes need magnesium, and cows and cattle also need magnesium in springtime to prevent grass tetany. I did some pricing up at Platinum Ag here in Murray Bridge, and it's not expensive. 25 kilograms of salt, $7, 25 kilograms of lime, $10, and 25 kilogram magnesium oxides, $25. So I think it's a really good investment to use that. I tend to find that if sheep need it, they'll eat it. If they don't need it, they won't. So that's a pretty good bargain at those sort of prices to keep your sheep really growing well and no pregnancy toxemia or grass tetany. You'll be very thankful for that. Pregnancy issues and lamb survival. Many of you will be scanning your ewes, but unfortunately many people don't as well. Particularly the small scale properties won't be scanning, but if you do have more than a couple of hundred ewes, probably, I reckon it would pay you to do that because it's important to manage ewes that are carrying twins and manage ewes that are carrying singles separately. The twin ewes will need more nutrition and the single one won't. And you can cull the empty ewes. They're just unproductive animals for you. So it's a good idea to think about preg testing. Many people will preg test their cattle, and that's for the same sort of reasons. Nutrition, it starts and ends. Most health in animals starts and ends the year with nutrition. Poor nutrition will give you poor results, and too much nutrition will cause fatty liver syndrome. Some of you who've got orchards or vineyards or a small block in the Adelaide Hills generally will suffer. Your animal will be suffering from too much nutrition and they'll be fat. So again, you can have a fatty liver syndrome, and sheep that have been locked up in confinement, a bit low on vitamin A as well, can get a fatty liver syndrome that looks a lot like pregnancy toxemia as well. So they'll produce weak lambs and poor ewes. Think about shelter. Energy demand is driven by cold, and you can simply construct some shelter if you've got an open paddock and those really cold southerly winds and westerlies come through. Perhaps if you've got some hay bales, you can stack up to provide just a bit of a windbreak. You may find that will help, particularly your lambs when we get some really cold weather in August or July. Predation, in my experience, that it's probably the least common cause of lamb losses, although people often blame foxes for their poor lambing percentages. I think they're not guilty a lot of the time. They certainly do clean up the dead lambs or the weak ones. And if you're losing lambs, if you go out in those cold mornings and you're seeing some dead lambs and they're very young lambs, like 1 or 2 days old in particular, just pick some up and weigh them or try and estimate their weights. And you'll find that if they're less than 2.5 or 3 kilograms, those lambs are never going to live. And anyway, you'd have to have brought them in and really looked after them carefully. They just don't have enough fat in their bodies to survive in the cold weather. So if you're getting lambs of that size, there's only one reason, and it is that the ewes didn't get adequate nutrition during pregnancy. The same goes in the opposite end of the spectrum. You can overfeed ewes, and some people are telling me now that they're getting prolapses from their ewes and having really big lambs, and that's too much nutrition late in the pregnancy. So if you're feeding, particularly if you're grain feeding or supplementary feeding with grain to your ewes, you probably need to ease that off in the last couple of weeks and keep up the hay to them. Don't shut it off rapidly, but just ease it back a bit and keep up good quality hay. Extra calcium and magnesium, as I've mentioned before, is pretty important. Pregnancy toxemia, I've mentioned this a little bit in passing. It's called twin lamb disease, and it's almost completely dependent on ewe nutrition. Either that the ewe is too fat or she's just doesn't have enough energy. Merino's ewes should be score 3 to 3.5 going into lambing. If you don't know what condition scoring is for sheep, then there's, again, just Google that and have a look at some of the really good fact sheets that are available on many of the government websites as well. It's pretty important to learn to do that, get someone to show you. It's a simple technique. Don't guess. You can get caught out guessing, and I've done it, and many people would have, particularly if they're in full wool. You can think they've got plenty of condition on them and you actually feel them and they don't. So score 3 to 3.5 going into lambing is good if you can get that. And I mentioned too much energy in the last 2 to 3 weeks could give you large lambs and then prolapses. I think there's a question about prolapses. I might come to that at the end. Recovery from fire damage. Sheep and cattle, preg testing. So you can expect, or you will expect and find that if you're properly badly impacted, and many of you have been this year by fires, that you will have lowered lambing percentages. And some of those ewes may have damaged teats but many do surprisingly well, I've found. If they've been through fires, and you would think they wouldn't be able to rear a lamb, but they do. But I've had some reports from the southeast, the Kylera fire area in particular, that they are seeing a bit lowered lamb percentages down there from ewes that didn't seem to be too badly affected. So don't be surprised if you see that. Preg testing is important again. If you're carrying unproductive animals, whether they're sheep or cattle, and you've got limited pasture and resources, then they should be moved off to someone who can look after them or sold for slaughter. Very difficult to see burnt teats in black cattle, and I'll show you some slides in a minute about what burnt teats look like, but you've got to really look closely, especially in black cattle. So in fire affected areas, again, I mentioned beware of parasite burdens, grain overloads. If you're feeding grain in whichever form, and they're hungry because it's cold, if they're not used to eating a lot of grain, you can get problems. If you're running low on hay and you buy hay, and be careful of buying mouldy hay, you might suffer from abortions or all sorts of issues with mouldy hay. Sometimes you'll get away with it, but sometimes you won't. Pneumonias are actually quite rare, but nevertheless, occasionally they do occur. I saw some a few weeks ago in some rams in particular that just come out of being with the ewes and then shorn, and then it got cold and wet, and some of them came down with pneumonia. So just be aware of that as well. And if you're in a fire affected area, your stocking density is higher, you are supplementary feeding still, you may have to use extra vaccination, particularly against pulpy kidney. So just bear that in mind as well. Here's some teats from the Kylera area that we saw. A couple of points I'd like you to look at on this slide is notice that the long hairs are burnt away from around the udder of that cow. So that's a bit of a clue that there might have been some damage. And this was about 3 or 4 days after the fire from memory. Of those 3 teats that you can see there, one of them looks like it's not going to be too good, but the other 2 probably would be okay. So this cow would have like a 50% chance of rearing a calf. The time to make a decision about these animals that are usually at the time we have fires is January and February. Usually most of them are due to calve in March, April. So the time to make decisions about whether these animals are going to be able to rear a calf or not is as soon as possible after the fire. So get some help to do that and go through them. So I think it's a thing that people are not aware of perhaps. Sometimes cattle just walking over burnt ground can damage their teats enough that they'll damage the bottom of the tip of the teat, and the calves won't be able to suckle. Introduction of new animals and hay. If you're bringing in replacement stock, beware of bargains. You might get a few extras that you'll regret. Like with hay, you can get mouldy hay or weeds with it, so beware of that. And with diseases, I've mentioned Johne's disease from interstate is something you could get. Always, and that's really, I can't emphasise that enough, always get completed health declarations. Besides being a legal requirement for coming into South Australia, it's just good sense. Find out what your cattle or sheep have been vaccinated with, what they know about the Johne's status of the herd or flock, etc., whether they've got pestivirus results or have any kind of idea about pestivirus in the cattle, for example, and whether they've been wormed and so on. There's a lot of good information available on those forms, and just get the people who are selling you sheep or cattle to fill them out to the best of their knowledge, and it gives you a place to start with. You'd be wise to ask a lot of the questions on those forms before you bring them home, and then think about quarantining them as well, because you can bring in resistant worms and parasites, lice, foot rot, and all sorts of things. So be on the alert for imported animals. Check the South Australian entry requirements for animals and hay. Some interstate places have some serious diseases and weeds and pests that we don't have, so we really don't appreciate getting them. There is a vendor declaration for hay as well, and that's called a commodity vendor declaration, and it's available on the MLA website. All of these declarations are free. They're available on our website, except the commodity vendor declaration, that's on the MLO one. But all of the animal health ones are available on our PIRSA website, and you can download them there and send them to your vendors. Quick word about a program that PIRSA has now been running for a bit over a year, 18 months. It's called One Biosecurity. It's a very good program. It's a web-based free program. Doesn't cost you anything to sign up. And it gives you some very good information about biosecurity hazards and risks and what you can do about them. It allows you to rank both your property, how well your biosecurity is going, and animals that you might consider buying. Rank them against your particular cattle or sheep, so that you can see the benefits of it. So it's free. It takes an hour or so to go through the questionnaires, but once it's done, it's done, and you don't really have to do too much after that. It's a good place to see a lot of information about biosecurity, which is becoming increasingly important, and people are more aware of it now than previously. There's a website address there. Just click on that and read up about it and join up. It's a good idea. Contacts, I'm getting toward the end of this talk now, but if you'd like more information, particularly about what you should or shouldn't do with vaccines and micronutrients and so on, local veterinarians are a good place to talk to, particularly in rural areas. On KI, you've got some excellent veterinarians there. They'll be very happy to advise you on what works and what doesn't, and what's necessary and what may be an option for you. Many of the retailers now have very good staff as well that can advise you about those things as well, and particularly nutrient requirements and trace elements and so on. Most of you will be within range of a PIRSA animal health staff. We now have 4 district veterinary officers in South Australia, so most of you should be able to contact somebody. And if you can't contact anybody and you've got a problem, then my phone number is there. I'd much rather people talk to me or somebody than worry and have a problem and then animals die needlessly. It just shouldn't be happening nowadays. So Google, of course, many of you will be using that frequently, as I do. And there's some really good web pages on interstate DPI websites about things like pregnancy toxemia or weeds or poisonings and so on. So some very good material available there for you. It's all free. Just look around. And lastly, in emergencies where you're seeing something that's really serious and you've never seen before and you're concerned, there's a 24-hour number that's monitored right around the country, in fact. And that number is 1800 675 888. So all of you should put that in your phones just to have it there, just like 000 for animals. So that's for emergencies, not just, what drench is going to work or micronutrients or something, but for emergencies. So do get to know your local district veterinary officer. Do get to know your local veterinarians where you have them available to you, and do get to know your PIRSA animal health staff. They all look forward to being useful and helpful to you. That's about the end of my talk. Tasha.
Excellent. Thanks for that, Jeremy. We do have some questions coming through. Okay, Jeremy, we've had some questions come through. The first one here is pros and cons of injectable drench versus oral drench.
Yeah, good question. They're both effective. I have reservations about the injectable one in that it's a bit of a one-size-fits-all type of approach. In areas where you probably don't have a lot of problems with internal parasites, worms, then things like WienerGuard and UGuard and so on, injectable drenches, I'm talking about sheep here, will be reasonably effective, and a lot of people use them, and it's a convenient way of giving them selenium as well, which is usually in those products, and sometimes B12. So they're a good idea. Where I do have a bit of a problem is where you might have a parasite problem and you're relying on one injection that might not be the right dose for some of these really heavier animals. And in some cases, there might be a resistance issue, particularly in the wetter country. With cattle, they're commonly used. I think a lot more people use pour-ons now for drenches with cattle because they're so convenient, and generally they're pretty effective. Oral drenches, I still think have a good place in sheep. particularly probably for lambs. I prefer them. I guess maybe it's my age or something, but I tend to prefer them, and I think you can adjust the dose a little bit better.
All right then, yes, we do have a question about prolapses. This person says, we always have a few prolapses in our ewes at lambing time. Do you know what might be causing this, and can they be successfully treated?
Yeah, good question. I think I talked about causes of it. Generally, it's fat ewes, but sometimes tail length is involved as well. And with lambs, if you've got lambs in feedlots, when they cough and so on, and you're getting rectal prolapses, that can be to do with tail length as well. So when you're tailing your lambs, if you've got a choice of going shorter or longer, go longer, and you should have less prolapse problems. But the fat ewes and big lambs, there's not a lot of things you can do about it once they're starting to lamb, and help the lamb out. Can you replace them and the ewes survive? Some of them will. Sheep don't tend to respond or to survive as well as cattle do. If they do survive, and there's a little tool that you can get from some of the retailers, Platinum Ag or Ag Nutrient and so on. It's a little plastic T-shaped thing that will keep the uterus in while it's starting to shrink down, and that has been used in the past, and some of you will know what I'm talking about, others of you will have a big question mark, but it is available to help keep the breeding bag or the uterus inside the ewe after you've replaced it. If you are going to do that, use nice warm water, not too much disinfectant, but just clean basically the dirt off it. Be very gentle, because it's very easy to tear it in ewes and puncture it and so on, and then the ewe won't survive. But be very gentle, clean it off and gently push it back in again. With cattle, most cattle will survive. No matter how bad the prolapse is, you can always get it back in. It's almost always a veterinary job, but most cattle will survive. So I personally feel a bit sorry when I hear about producers who've shot cattle because they've had a uterine prolapse, because they can always be put back in. That's it, I think.
Jeremy, I've got a bit of a long question here. It's a bit of a scenario for you. Say sheep have been on grain with some buffering pellets for 3 months, but now there is some green feed. They're not eating the hay provided, and their droppings are now soft with whole grain in them. One ewe has been successfully treated for preg tox. Another seemed blind or disorientated, but now cannot be found acting disorientated, staring at me before going to the trough. What does this mean for the feeding regime?
Yeah, good. Thanks, Tasha. I think there's a couple of things there. The whole grain coming through and they're a bit loose may mean that they're getting a bit too much as well. So you might have to wind that feeder back a bit and make sure they get plenty of hay. The second condition, where they're looking spaced out and gazing at the sky, or just sitting there in the corner and pretty out of it sort of thing, is probably a condition we call PEM, that polioencephalomalacia. Don't worry about the name of it. But the good news about that condition is that it responds really well to vitamin B1 injection. That's a cheap treatment. You can get it from vets, or some wholesalers stock it as well. It's worth having on the shelf. It doesn't go out of date really, even though it's got expiry on it, it'll last a long time. And only couple of mils, I think it is, with sheep. Dose, if they respond to it, they'll respond within about 20 minutes or half an hour, get up and that'll be it. If they don't respond, then it's not PEM. So a very good treatment for that particular condition. If you're seeing a fair bit of it, and many of you will if you're feedlotting, it's due to a rapid change in diet or a high grain diet generally. There's a couple of other causes as well, but that's usually where you see it, with a change in diet or too much grain. You might consider putting vitamin B1 or thiamine in the water all the time. And I've known feedlots that do that and they never see PEM again. So it's very easy to treat and cheap to treat, but they'll die if they're not treated.
Excellent. Thanks, Jeremy. I think we might just leave it there for now. So moving on with tonight's program, we just wanted to make people aware of some upcoming opportunities for particular people that may have been impacted by the recent bushfires. MLA are offering producers in the fire-affected regions 3 free one-on-one sessions with a local farm management consultant to help them put their businesses back on track. For people that may want to take up this opportunity, the best contact is to go straight to Livestock SA, either via their website or the number that you can see there on screen. Also, I'd like to make people aware that the deadline for the PIRSA bushfire response grant, the deadline for that is coming up on the 31st of July. If also you wish to have more information regarding those grants, please refer to the PIRSA website. Okay, so just in conclusion of tonight's webinar, we'd just like to thank our sponsors, in particular MLA and AWI, and of course Jeremy. We thank you for sharing your insights and your expertise on this topic. If you have any additional technical questions regarding tonight's topic, please contact myself. So I thank you for your time and have a wonderful evening.